Welcome everyone to another dental practice case presentation. My name is Drew with Preferred Dentistry. We'll be going over a project that I recently completed for a client. We'll be going through some of the experiences that they're going through and some of the desired outcomes that they have and what are some steps that we went through. A little bit about me. I completed 2 graduate degrees for $150,000. I have over 10 years of healthcare administration experience. And I did all of that to help you because the average dentist retires 7 years after the average worker. And so hopefully the work that we do here with Preferred Dentistry will help you eliminate that. And let's just cut to the chase, all right? All right, so here's some of the information that's pertinent to the case. With this particular dental practice, they recently experienced some turnover. They recently promoted from within a new office manager who's been with the practice for over 15 years. And what the dentist is noticing is that they haven't hired very many additional staff members, and yet they are seeing an increase in 50% of their staff salary. And so of their total overhead, they move from 20 to 30%, which is a large increase. Maybe you've seen something similar in your dental practice. Employees have more leverage and they're pushing for higher wages. So same thing is happening in this particular practice. And so a little bit more about the dental practice and where they're situated. They're located within an affluent area, and in that area, as you would expect, the population is healthier. The practice has been around for quite a while, for about 40 years, and it's a single dentist owner with 3 associates. 30% of the payer mixes are out-of-pocket payers, and 70% are privately insured. And they have a really good production to collection rate of 100%. They do provide in-house financing with a credit of 18%. And no, they're a really busy practice with 11 hygiene days and weeks. So there's a lot of money coming in, and there's also a lot of money going out. Like I said, they recently experienced 50% increase in their payroll. Not only that, with the implementation, with the onboarding of a new office manager, yes, they are familiar with the standard operating procedures, but this is a new experience for this manager. And so it's important for the owner to update and also implement SOP, standard operating procedures. They are looking into procuring capital equipment of 3D scanners. And also with the recent turnover, they're experiencing hiring expenses. The question that the dentist had was, there's a lot of money going out, and maybe you've asked yourself the same question of, what about me? My staff is getting raises. What about me? Do I get a raise? And so hopefully through this case study, we'll look at what that raise might look like and how we might get there. Now, on the next slide, I don't want you to get too worried, but we do have a sigmoidal curve. And no, there won't be any discussion on oxygen dissociation, but we will talk about dental practice and the growth trajectory and what that looks like. And hopefully you can stick with me and we'll see how we get there, how we arrive there. All right, so for this particular practice, they have, for the past month, they saw 1,125 patients. It's a high number. Of those patients, 130 were new ones. And of the 130, 20 were referred. So 110 were actually acquired through traditional methods of marketing. And so we have here the patient lifetime value, the value of a patient over the lifetime of there being a patient here at this particular dental practice, which is $5,600. And then we also have their patient attrition rate of 50%. So over 18-month period, for those who are unfamiliar with the patient attrition, I know some managers are watching this video and might not track this number. Patient attrition, 50%. So the number of active patients 18 months ago, how many of them have been seen in the 18 months since? And so for this particular practice, their rate is 50%. So what does that mean? Of the 1,125 patients that were seen last month, if we were to continue this trend of 50%, half of them will be lost and will not be seen from between now and 18 months. One way that we can look at this is what is the upside? What's the potential growth if this dental practice were to continue? How much more growth can they experience? At 50% attrition rate, that means if you were to divide the number of new patients, so the true new patients would be 110, because we said that 20 were referred patients. 110 divided by 50% would be an additional 220. So 220 new patients are what this practice can stand to gain with this, if the number of new patients were to remain the same and the patient attrition rate were to remain the same. So meaning they're basically operating at 80% capacity of what this trajectory can maintain. So that's where this blue star is, with the orange dashed horizontal line being the hypothetical max. Now, what does that mean? What does that look like? All right, so an additional 220 patients per month would be 1,345 patients that this practice can see. Now, keep in mind that these are unique patients. These are not counting the additional visits, follow-up visits that patients have. Now, let's look at what this growth curve might look like if we were to maintain the same number of new patients, maintain the same number of referred patients, and maintain the same value for patient lifetime value of each patient. Now, what would happen if we were to decrease the attrition rate from 50%, losing 50% of your patients, 1 out of 2, down to 20%, or 1 out of 5? What would the growth potential look like for this particular dental practice? Well, let's take a look. Like we said, what we would do is we would take the number of new patients and divide it by the patient attrition rate. Now, what does that number look like when we decrease it down to 20%? Meaning we take that 110 new patients and we divide it by 20%. Let's see what that number looks like. You see that number jumps from 1,345 up to 1,675. Now, where the dental practice is performing now is less than 50%. So now you can actually see a doubling, a potential to double your production and your collection, because remember, we're at 100% for this particular dental practice. And so this would be completely unreasonable, but maintaining the same number of new patients and the same number of referred patients, same number of patient lifetime value, but decreasing the attrition rate down to 20%. Now, why would I say that it would be unreasonable to expect a change? But I just did that for simplicity and to demonstrate the potential growth for this particular practice. If you are at a 20% attrition rate, then patient satisfaction scores are probably going up. And so when that occurs, the referral program tends to increase as well. And now when you are retaining your patients, increases the recurring of their number of visits that they have. And so it would be reasonable to expect that value of $5,600 to increase, right? But it's going back to that question of what type of a raise can the dentist expect to have? And the simplest answer would be they can double, right? Now the ceiling doubles. There's other factors that go into it, and we can continue this this case study further. But I just wanted to share with you, how can a dentist receive their own raise, and what type of raise can they expect to have? So over the next 18 months, if this practice were to maintain that 20% attrition rate, this dentist can expect to double their income. Now that can be exciting. Now, what can we do to decrease our attrition rate down to 20%? We can save that for another case study as well. So now, in the real world, we deal with people. We don't deal with numbers, right? And when we deal with people, they have their own complexities with their own motivations that are not always in alignment with the dentist. But what are some arguments against changing? Number one, like I said, the average dentist retires 7 years later than the average worker. Some dentists just want to retire 7 years later and don't want to change, and that's okay. Another reason why they don't want to change, so the nasty 4-letter word, work. Change requires work. Work can be painful sometimes. And other things that you can expect to see is a culture change. There's going to be a lot more required. There's going to be a lot more effort required. And then there's going to be some sacrifices, some things that they're going to have to leave behind. I kind of laugh sometimes that when we implement these programs, there's less talking side by side and more talking on the phone. Now imagine that. Yes, employees are seeing higher wages, but hopefully we can expect, it would be reasonable to expect more outcome, more output from our employees, right? And then changes patient panel dynamic, more hygiene and less treatment. When we retain our patients, yes, it would be normal to expect to see more hygiene, and you might need to hire new hygienists. You might need to change the number of chairs that are in your practice, or wait for it, you might need to open another location. And those are all issues that we can cover in our next case study. So topics that we're going to cover next time is expand or contract our practice, capacity and utilization rates, and break-even analysis. Thanks for joining with me. Catch you next time.